Ever find yourself trying to decode those mysterious tummy aches kids get, like, is it something they ate or are they nervous about that spelling test?
Right.
Well, get ready to dive into a health connection that's often missed, especially when it comes to kids with autism, GERD. That's gastroesophageal reflux disease, in case you haven't brushed up on your medical acronyms lately.
And we're talking surprisingly common here. Like the article you sent in of that stat about up to 70% of kids with autism experiencing GERD, that's huge.
70. Seriously. Okay, that's way more than just a random stomach ache now and then. Parents and caregivers definitely need to have this on their radar.
Absolutely.
But before we get too far, let's back up for a sec. For anyone who's hearing G or art and picturing like a medieval villain, what is it exactly?
So GERD, it's basically when stomach acid decides to take a little trip back up the esophagus. You know that burning feeling you get with heartburn?
Oh, yeah.
That's essentially what folks with GERD, including young kids, can be dealing with.
Not fun at all. So why is this G or D autism link something we should really be paying attention to?
Well, a lot of it comes down to the sensory side of things. Kids with autism, they often have these sensitivities that really affect what they'll eat.
Mm.
Imagine a child who only eats, say, mashed potatoes and yogurt because other textures freak them out.
Trying to be accommodating but could backfire?
Exactly.
Yeah.
They might be avoiding foods that actually make reflux worse without even realizing it.
And on top of that, if a child has trouble communicating what they're feeling.
Oh, absolutely. They might not be able to say, hey, my chest is on fire. So it's easy to misinterpret those signals.
It's like a guessing game for everyone involved.
And to make things even trickier, some medications used for autism-related things, they can actually have side effects that mess with digestion.
So many moving pieces. But just knowing this connection exists has got to be a good starting point, right?
For sure. It lets us move from being totally lost to, okay, what can we look for?
Exactly. From confusion to action. From confusion to action. I like that. So for our listeners who are thinking, okay, this makes sense, but where do we even start? The article does have some helpful tips, right?
It does. And a good place to begin is by thinking about food a little differently.
Okay. Oh, so
We often think of food as just, fuel.
right.
But for a child with sensory sensitivities, it can be a whole sensory overload.
Yeah.
So figuring out those individual triggers is so important.
So instead of just eat your veggies, it's more like playing detective.
Exactly. It's about watching for patterns.
Right.
What seems to consistently cause problems?
Mm.
Is it spicy foods, tomatoes? Some kids even react to dairy, which a lot of people don't realize can be a trigger for reflux.
Good point. So much for the Milk Does a Body Good campaign. It's really about figuring out what works for each individual child.
Absolutely. And sometimes it's not even just the food itself, but the amount.
Oh, you mean like portion sizes?
Exactly. Smaller, more frequent meals can be way easier to handle.
Makes sense. It's like the difference between trying to chug a gallon of milk and like sipping on a small glass.
Exactly. And you know what else can help? Routine. When a child knows what to expect at mealtimes, it can really reduce their anxiety.
And less stress usually means happier tummies.
And
Right.
it's not just what they eat, but even how they sit. Encouraging them to stay upright for a bit after eating can make a big difference.
Let gravity do its thing. Keep that acid from sneaking back up. Clever. Okay, so we've got some good strategies to try at home, but the article really stresses this isn't a DIY situation. We need to loop in the professionals, right?
Definitely. Pediatricians, pediatric gastroenterologists, and even therapists who specialize in feeding issues, they can all play a role.
A whole team of experts.
Exactly. They can rule out other possibilities and come up with a plan tailored to that specific child.
And that's where open communication between parents, caregivers, and the healthcare team is so vital. It really highlights how important communication is across the board. But, as I was reading this article, something kept bugging me. It focuses on kids, right? What about adults with autism?
Oh, that's interesting.
Could this GERD connection be getting missed in adults too?
That's a really good question, and it's true. So much of the focus is on diagnosing early in childhood.
Right.
We don't want to forget that these experiences don't just magically disappear when someone turns 18.
Exactly.
Adults with autism, they might face even more challenges when it comes to recognizing and talking about their health issues.
Especially if they're nonverbal or have limited communication.
Absolutely.
Mm.
We've got to be more aware and create a healthcare system that's truly inclusive for everyone.
It all comes back to that idea of connection. And our understanding of these issues, it needs to grow and evolve alongside people's lives.
Well, I think we've given our listeners a lot to think about today, and maybe some heartburn along the way.
Hopefully not. But seriously, this is a conversation that shouldn't end when this episode does. If something resonated with you, talk to your doctor, find some good autism support groups, and never be afraid to ask questions.
Couldn't agree more.
Knowledge is powerful, and sometimes, just like those rebellious stomachs we've been talking about, it has a way of making itself heard when we least expect it.